Welcome to the Good Day at Work podcast. I'm your host, Matt Liggins, and in this episode, we'll be exploring the nuances of workplace wellbeing with help from leaders and experts in helping to create good days at work. So, what makes a good day at work? Let's find out. Hello and welcome to this latest edition of the Robertson Cooper podcast. And today we're going to be talking about men's health. I'm really pleased to have our guest on the podcast today as Dr. Nick Zygouris. Nick, I'll let you do a bit of an introduction and tell people about your backgrounds. Welcome to the podcast.
Thank you very much, Matt. It's a delight to be here. I am a clinical psychologist by training. I have been in active clinical practice throughout my career. For the last 15 years, I worked primarily with men in various settings, from secure hospitals to prisons and in private practice. And I'm here quite delighted to talk about something that is quite close to my heart.
Well, fantastic. We're really grateful for you sharing your time and your expertise. So we'll get straight into the conversation, shall we? I mean, when you look at the research and the background of men's health, sort of, if we look at our statistics, sort of, we know that generally men's life expectancy is about 4 years less than women from the same generation. Men tend to be disproportionately affected by certain cancers, by heart disease, and by type 2 diabetes, and which are the kind of health conditions which obviously can be genetic and hereditary, but are often caused by lifestyle factors. And we know that also that men are less likely to visit the doctor than women are, or to wait until things have progressed to a stage where their health is worse before they do seek healthcare advice. And we unfortunately know as well that rates of suicide are quite considerably higher in men than in women. So what kind of factors do you think influence all these disparities in men's health?
Yeah, and you're absolutely right. And thinking about some of the key statistics that you mentioned in terms of the suicide rates. The suicide rates for men is more than 3 times higher than what we see in women, and for men below the age of 50 is quite a significant contributor to the mortality statistics that we see. I think it's very easy for us to jump into some conclusions that biology is playing quite a strong role here. And obviously biology does impact. There are some conditions that you find more that are more gender specific, like prostate cancer, that we find more in men. However, what we see is a much more complex picture in here. And you touched about some of those factors that seem to be more behavioral in nature and more social in nature. So some of those behavioral factors that we see is that men tend to engage more with risk-related behaviors, and this is quite interesting in terms of how do men end up engaging more with risk-related behaviors. So, for example, we know that men tend to consume more alcohol. They may engage more with social activities or hobbies that are more risky in nature. They may have a diet that is much more harmful to them, eating more in excess. It's quite interesting for us to start thinking in terms of, okay, how do men, when they reach the adulthood, start developing have those risk behaviors. And I think we need to go further back when someone is growing up and is being socialized about how to be a male, how they need to behave. And that's where we see some of the peer pressures, some of the peer preferences in terms of what makes you stand out in groups, what is some of the behavior that makes you maybe be more socially acceptable within peers, that might involve you engaging with behaviors that may be a little bit more extreme. And over time, you get socialized to actually feel more comfortable with danger and with risk. So risk-related behaviors further on in life, for someone who started like this with those experiences, might feel something more comfortable and less risky in their own mind, but not because they're objectively less risky. It's just they feel more comfortable with the idea. You also mentioned about help-seeking behaviors, and we do see that men tend to seek support less. Many more women are going to the GP and engaging when they have a risk-related concern. Women are also much better in terms of preventative, seeking out support even before they have a health-related condition. We do see a different pattern with men where it needs to get really bad before they seek out support from a healthcare professional. That idea about maybe telling themselves that it's not something, it's just going to go away, it's not going to be something serious, as a way of reassuring themselves in the moment, but actually by not seeking that support that they require, the problem only gets worse in the long run. And then we have all those cultural factors and social factors, which again is they're probably coming from how we are socialized at a very young age in terms of manning up. Just the mere expression of manning up indicates that there is a sort of social norms about how a man should behave and what they should, and the behaviors that they should be demonstrating or not demonstrating, especially at times that they are experiencing challenges. And there is another social and cultural factor which has to do with the type of jobs and employments that men tend to seek, which might be more physical in nature, that might be more dangerous in terms of the activities that are being performed during that employment. That again, we see that can have a direct impact in the physical health and potentially in the mental health. As an extension.
I guess you touched on this there as well in terms of those psychological risk factors. We talked about sort of risk-taking behaviours and attitudes, and as you say, the statistics point to the fact that men are probably more likely to drink alcohol than women. They're more likely to engage in gambling. They're more likely to smoke even as well, and they're more likely to do these things to excess where it causes those issues. Because while sort of things like drinking a small amount of alcohol or sort of having the odd bet isn't necessarily harmful, but it certainly can be, and it tends to be men who do sort of fall foul of those sort of things more so than women. So we talked about those risk factors, but is there an element that sort of masculinity, or these conversations we're having sort of now, we're hearing the media around toxic masculinity, plays in this?
Yeah, masculinity is a set of behaviors, isn't it? And those behaviors change, are being defined and redefined by society at different times, but some elements are contributing to those behaviors. Again, going back to the manning up attitude. One of the things that I hear a lot from my clinical work from men is a fear about how they may be perceived if they were to express that they have a problem, if they were to share with their loved ones that they have a problem. There is a strong expectation, self-expectation, that they need to always perform at the highest level of their performance. And that can be in the workplace, that can be in any area of their life. As parents, as fathers, as husbands, they feel that they need to be performing at a very, very high level all of the time, and that if they don't, then that somehow emasculates them, that somehow takes away their manhood. And that can be a serious problem. That can be a serious problem because it ends up, it results to people talking less about the problems that they have. They end up bottling up those problems, and they're ending up without the support around them in order to find ways to move forward. And that support doesn't always need to be professional. That support in the first instance can be the social network that men have. One of the other things that I tend to find in clinical practice that is quite interesting is what we tend to refer to in psychology as normative alexithymia. And basically what this means is that people can find it hard to recognize how they feel and also to express their emotions. So one of the things that I find in clinical practice that I have to do very early on with men, more so than with women, is actually help them understand what feeling different emotions might mean. Now, thinking about how the way men tend to go about solving problems, if the tire of the car gets a puncture, you get the tool, you change the tire. In the physical world, this is a fairly straightforward problem-solving process because you understand what the problem is, you understand the components that you need to utilize in order to change the tire. Now, when it comes to emotional problems and to mental health, if you have not been socialized to talk about your emotions, to recognize your emotions, to manage your emotions in a way that is socially appropriate, then you tend to lack those tools. So as part of the treatment, we need to start with the basics. How does it feel to be angry? How does it feel to be anxious? How does it feel to be sad? How does it feel to be terrified of a situation? And with a lot of men, one of the things that I find is that they find it easier to talk about and express some emotions. If you think about emotions, being angry and frustrated is something that is considered more socially acceptable for men, because it's less emasculating to feel. For some men, they consider that less emasculating to feel angry or frustrated. But when it comes to emotions like sadness, like anxiety, these are emotions that I find that men find it much more difficult to talk about, and as a result, they almost don't have that internal perception of what is the difference of me feeling anxious, what's the difference of me versus me feeling sad versus me feeling frustrated. So it's very interesting when we start unpacking the situation with men. A lot of men start with a feeling of anxiety, of frustration, that they come to therapy, and actually when we dig down, we find out that it's more about the sadness, it's more about anxiety, it's more about one of those more emotions that make us feel more vulnerable when we share them with other people. To give you an example, a few months ago, I saw a gentleman. He's a doctor, incidentally, and he came because he was feeling very frustrated with his young boy, who was 5 years old. And he was finding it really hard to relate to the boy. The boy was not relating to him. He was getting more and more frustrated whenever he had to take care of his son. And that was expressed in a way that for men is a little bit more socially more self-acceptable, which is that frustration and the anger. And so he came to me with concerns and wanting to work on anger management. When we started digging down and understanding what actually were the real thing that was going on for him, it was not the frustration with the boy. It was a sense of rejection that he was feeling, that his son was not relating to him in the way that he wanted to. It was the sense of, and the sadness, that he thought his son was relating to his wife in a much stronger way than he was relating to him. He was feeling that sadness was much higher. It was a sense of anxiety that if I'm left with him, I'm going to get angry again. I'm only going to make the relationship even worse. So ended up avoiding the child and not building the relationship that they could have had. So this is just a typical example that I see time and time again, where men come into treatment and they present with one problem. And once we start doing some work around understanding emotions, understanding their emotional states, that allows them to start seeing the situation for what it is. And actually they can see where the puncture is on the tire, so they can fix it, rather than trying to either inflate the tire when there is a puncture, or try to put a patch on the puncture at the wrong place.
Quite a lot of parallels with the things that you've been talking about in sort of men's day-to-day life and the issues that can affect our health and our well-being, with, I guess, that risk-taking behaviour, that concept of masculinity and sort of perceptions of how we ought to behave and how perhaps we shouldn't behave. But then also those elements of just not having quite the tools and almost that internal language to understand what's going on to deal with that. How do some of these things map into the workplace? Because if we talked about struggling with certain emotions like feeling sad, how do you find in the workplace men are able to respond with things like dealing with things like stress? Is that something that might sort of impact their, I guess, sort of, their perception of masculinity and whether they should or shouldn't feel stress? How do some of these things we've been talking about affect the working day?
Yeah, it's an interesting puzzle when we think about men in the workplace. One of the key elements I think we need to consider is what happens to men and their social relationships as they're growing older, they're growing into having a family and so on. And one of the things that we're finding is that men tend to have less social relationships than women. And as they are growing older by midlife, I think it's about one out of five is going to say that they don't have anyone close to them. And once life starts to become more complicated, more complex, the responsibilities pile up. Some of the things that men tend to drop is the relationship that they have with their mates and the buddies, and they focus on becoming the providers, on making sure that they fulfill other goals and ambitions that they may have. But again, that has an impact in that in the workplace then becomes a place where they socialize with other men, a place where that sense of being together with other people and with other men, and they can all work together towards a common goal that they find important one way or another. So the workplace can become quite central for men as they grow up, and I think it provides a great opportunity for us and for employers to use that common space for men to make sure that they have opportunities to build those relationships, those social relationships that we know have a massive positive impact on someone's mental health, well-being, and physical health, and utilize those spaces in order to promote both mental health, but also promoting physical health. I think workspace are absolutely crucial as to support physical and health and mental health for men.
Absolutely. I mean, Nice Guidance has kind of said that for a number of years, hasn't it? That the workplace can be a key conduit for sort of not only helping those who work there, but actually members of their families and communities as well, if we can kind of get those messages right and those habits right as part of the working day. And as you say, particularly for men, if that becomes such a key part of their life, as those maybe some of those social relationships tend to dwindle. One thing we do here at Robertson Cooper, we can help quantify how many good days at work an organization is having, and social relationships is one of those key measures of that part. So really chimed with what you're saying. How does the, I guess, shifting world of work at the moment impact on that? Because if we're working more remotely, we're working more hybrid, and we're saying actually the workplace and work colleagues are such a key part of supporting men's health, if some of those relationships are now changing and there's even less contact, does that pose a greater risk? And do workplaces have to be quite careful in terms of how they manage that, particularly for male employees?
Yeah, absolutely. And I think employers have a wide range of opportunities to support employees and male employees in general. You know, going back to what I was saying around the difficulty in understanding and expressing emotions, mental health awareness training, emotional awareness training in the workplace can be hugely beneficial, both in terms of productivity and well-being at work, but also outside of work. Once you have those skills, you can use them inside or outside the work. Training line managers to ask questions around well-being and feel comfortable asking questions about well-being. One of the things that I tend to always start with in line management sessions is asking my colleague how they are. And usually, typically, the kind of the social typical response that I tend to get with colleagues who live in the UK is that I'm okay. I'm asking no, and I think that's the key, that you need to stop and ask no. How are you really? And that's where you need to pause and allow the other person to speak, so that you can really get a sense. Getting just the first answer is usually not enough to find out about someone's well-being, and that's just a small thing that a line manager can do, and there is a wealth of other things that they can do, and those things can be relevant trainings can provide that additional skill set, but also provide the confidence to ask those questions and normalize asking those questions. Other things that employers can do is modeling what appropriate level of sharing with regards to own mental health and well-being it is. So having leaders and senior leaders in the team talking about their own mental health, physical health in an appropriate way and openly, safely, but openly with the rest of the colleagues, such a culture that actually talking about physical and mental health difficulties is not something that is going to penalize you in any way, shape or form, because that can be a concern that some employees may have. Again, going back to some of those core beliefs that someone may have. If I were to share that actually I'm struggling, then that means I'm not good enough. Then might that mean that I'm not going to be considered for the next promotion. But having senior leaders actually taking a strong position and sharing those things themselves changes the culture, creating spaces. And those spaces you said about working virtually, working in the office, those spaces can be either virtual or it can be in the office. Creating spaces where people can come together and they can talk about the well-being, and whether you need to consider these spaces could be either gender specific or it could be for all colleagues. And actually, I've seen that working both ways. You need to consider the setting. Maybe for some professions, you may need to start with more gender specifics and then progress to more blended groups that have both genders in place. But actually, those are opportunities that can be put together by the employer, whether someone is working remotely or not. I think the key direction that employers need to be working towards is to create a culture where taking care of your physical and mental health and being open and transparent to the extent that you want to be with your line manager in the very least is something that is considered to be a good example of being a good employee. And it makes sense on so many levels. It makes sense in terms of taking care of your staff, increasing the staff engagement with the organization. But an employee who proactively takes care of their health, they're going to take less sickness, and they're going to be more productive overall in the workplace.
Fantastic stuff. So some really important takeaways there for employers. So you're talking about creating opportunities where being able to discuss our emotions and have those conversations, and also I guess opportunities to get involved in looking after our health and well-being are really important. But perhaps when it comes to certain male employees, it might be important to perhaps just prompt those opportunities a little bit more, to ask those questions twice. That's something that I've always encouraged when I'm doing line manager training sessions and things as well. It is around always asking twice, but it's around always asking, isn't it? Sort of, if the first time you're having a conversation, particularly with a male employee, maybe who doesn't necessarily have the language and the tools to be able to discuss these topics, or any employee who might not, if the first time you ask that question of how are you is when someone's really feeling at their lowest ebb and their back's against the wall, it's not, that conversation is not going to go as well as if someone always asks that question and actually start to able to open up once you're in a better place, because these things can take time to build up, can't they? So as you say, it's creating those opportunities on a regular basis. So yeah, some brilliant advice there, Nick. Lastly, I suppose, are there any good signposting routes that you might suggest? Because with the best will in the world, trying to create these opportunities for conversations is really important, but it might well be that actually beyond having those conversations, we might need as colleagues or as managers to recommend that people within our team or organization seek support, or it might be that we want to make those opportunities available so people can, if they're just not able to have that conversation for whatever reason, they know where that support route is with a professional like yourself. Are there any good examples or any recommendations that you'd encourage workplaces to share where male employees or all employees might be able to get support?
There are a number, and I'm going to share a few with you. I think it's important to consider, how do we frame that as well? How do we frame sharing that information so that it lands and it makes it easier for people to digest and take it on as an opportunity? And one of the ways that I tend to think about it when I'm referring to my clients is ask them about how they treat the car. And men in the car, they tend to have, I'm generalizing now, but they tend to have a kind of a special relationship. You know, you never miss an MOT or a service. If you hear, if a light goes on your dashboard, you are going to do something about it. You're just not going to let it turn into a disaster. And I think we need to start having this kind of relationship with our own physical and mental health. When we start having a pain, either physical or emotional, something that is niggling us, we need to take action rather than waiting until things are going to get worse. The first point of call is GP and NHS services. Obviously, for those who are between the ages of 40 and 47, there is the NHS health check. that they can go and do. But if they haven't been to the GP for a very long time, it's probably a good idea just to have a checkup with them, and talk about both physical and mental health concerns that they may have with someone who is professional, someone who can direct them to local services that would be relevant to them. I have to say that if someone is at risk, we talked about suicide being a major challenge when it comes to men. If someone feels that they are at risk to themselves, then calling NHS 111 is the right thing to do, and they can make sure that they can put a protective support around them immediately, so that things don't get worse for them. There is obviously the Samaritans that a lot of people have heard about, confidential talking service. It can be listening service. It can be accessed on 116 123 from any mobile or landline, and that's 24/7. You can talk to the individual. They are trained to hear, to listen to you, to understand the difficulties that you're going through, and they are non-judgmental. I used to be a volunteer for the Samaritans while I was going through my training, and a lot of men call, and a lot of men tend to call after hours. So the reason why I'm saying that is that if you're hesitant, just do it. There are so many other men that they are doing it, and the person on the other side of the line is experienced to listen and support and direct you with the challenges that you have. There is the campaign against living miserably or calm. And again, this is a suicide prevention support line that is dedicated to preventing male suicide. And then we have things like the Men's Shed Association, where it's a community program where men can go do something physical, something like DIY or woodwork alongside other men, have a cup, socialize, have fun, and be in the company of other men. And another one, last but not least, is Andy's Men's Club, which is a peer support group. And again, this is it provides a safe, non-judgmental place for people to talk about whatever is bothering them. So just a starter for 10. There is many others out there that they are very worthwhile, but those are some that would be kind of my top pick.
Brilliant stuff. Fantastic. One thing I've always encouraged workplaces to introduce is a simple sort of get help page, maybe on their staff intranet, or maybe it's a document that they share with staff. So maybe just capturing some of those organizations, maybe their web links or their phone numbers there, and just having it as a resource around the workplace. It just means then that sort of line managers know they can use it. It means that individuals and employees, men and women, can access some of those services and get to the support hopefully they need in that preventative space as well, which is great. So some brilliant suggestions there. Thank you very much for all your time, Nick, and all your expertise and insight. It's been really fascinating listening to you talk, and hopefully I'm sure our listeners have found that useful, and hopefully they can take on board some of the pieces of advice that you've shared with us. Right, well, we'll leave it there. Thank you again, our listeners too, for listening to the podcast, and thanks again, Nick, for being a brilliant guest.
Thank you very much.
Thank you so much for listening to the Good Day at Work podcast, brought to you by Robertson Cooper. If you enjoyed this episode, be sure to subscribe, like, and leave a review. Every time you do, it helps us to promote our podcast and increases the chances of others finding the show too. For further details on Robertson Cooper and how our evidence-based solutions drive tangible improvements in workplace well-being, mental health, and engagement, head over to robertsoncooper.com. See you next time.